about.
How many nurses and doctors will lose their jobs?
Well, look, we have undertaken a very important reform this year. We've put the figure out in terms of the overall number of around 4,000 people in health. But the bottom line is that the local hospital boards we've put in charge are the ones that will work out how they plan their workforce needs in the future. The bottom line is frontline services will be preserved, but nurses and doctors, well, look, it's like this. I'll give you the example I gave in the Parliament today to really try and remind the Labor Party about the way that the world changes and things can be done in achieving the outcome with fewer people. If you go back 40 years ago in this city, the garbage was collected by a truck with 3 people, a driver and 2 Garbos. Today that job is done with 1 truck and 1 person because of changes in technology and changes in work practices. It's a similar...
But we're not talking about Garbos here, Mr Newman, we're talking about healthcare workers.
We are, indeed, and many of the nurses and doctors that the unions are carrying on about are actually in administrative positions. And that's a sad fact. There are whole heaps of people, layers of administration in Queensland Health that frankly don't add value, and people in positions that are not treating sick people. And we need to deal with that. And if I just take you back last year, the former Premier, Anna Bligh, told us that Queensland Health was dysfunctional. That's not a reflection on the individuals, it's a reflection on the bureaucracy that had been built up. But we were told it was dysfunctional, we were told it was a bloated bureaucracy and it needed to be reformed. Now, if you listen to the unions and the Labor Party in this state, you actually take 1 person out of the organisation and everyone's going to scream and shout and say that that's going to destroy healthcare in this state. More money, Emma, is not the answer.